Peripartum mood disturbances. Peripartum mood disturbances begin during pregnancy or within 4 weeks after delivery. The risk is higher in women with a prior history of mood disorders. Postpartum blues occur in about 50 to 85% of mothers. Symptoms include depressed affect, tearfulness, and fatigue starting 2 to 3 days after delivery. These symptoms are usually self-limited and resolve within 2 weeks. Treatment, supportive care, but follow-up is essential to monitor for possible progression to major depression. Major depressive disorder with peripartum onset, formerly called postpartum depression, occurs in 10 to 15% of mothers. It meets the full criteria for major depressive disorder, with onset either during pregnancy or within 4 weeks after delivery. Treatment, cognitive behavioral therapy, and SSRIs are first line. Postpartum psychosis is rare, with an incidence of 0.1 to 0.2%. It is characterized by mood-congruent delusions, hallucinations, and thoughts of harming the baby or self. Risk factors include first pregnancy, family history of bipolar disorder or psychosis, and recent changes in medication. Treatment, immediate hospitalization and initiation of an atypical antipsychotic. If insufficient, electroconvulsive therapy may be required. Electroconvulsive therapy, ECT. ECT is a rapid-acting method to treat refractory depression, depression with psychotic symptoms, catatonia, and acute suicidality. The procedure induces a tonic-clonic seizure under anesthesia and neuromuscular blockade. Adverse effects include disorientation, headache, and partial anterograde or retrograde amnesia, which usually resolve within 6 months. There are no absolute contraindications. ECT is safe for pregnant individuals and older adults. Risk factors for suicide death. Remember the mnemonic SAD persons. Sex, male. Age, young adults or older adults. Depression, previous suicide attempt, which is the highest risk factor. Ethanol or drug use. Rational thinking loss, as in psychosis. Sickness due to medical illness. Organized suicide plan. No spouse or social support. Stated future intent. Patients with SAD persons are more likely to die from suicide. In the United States, the most common method is firearms, and access to guns greatly increases the risk of death. Women attempt suicide more often, but men die more often. Other risk factors include recent psychiatric hospitalization and family history of suicide. Protective factors include effective care for comorbidities, strong family and community connectedness, cultural or religious beliefs that discourage suicide, and strong problem-solving skills. Anxiety disorders. Anxiety disorders involve inappropriate experiences of fear or worry, along with physical manifestations that are out of proportion to the stressor. Symptoms cannot be explained by another medical condition, such as hyperthyroidism or by substance use. Anxiety disorders include panic disorder, phobias, generalized anxiety disorder, selective mutism, illness anxiety disorder, obsessive-compulsive disorder, post-traumatic stress disorder,